Hey y'all, Kayla Mowdy, Doctor of Physical Therapy, here with another Monday Educational Moment. So today I'm going to talk about the reverse Kegel. So in a past video, I've talked about doing Kegels for stress urinary incontinence when it's just a small amount and there is no overactivity of the pelvic floor. So no signs of frequency, urgency, and leaking in those situations. It's just leaking with coughing, sneezing, and maybe picking up something heavy. So a few things I look at when I'm looking and to see if someone has a shortened pelvic floor. So the pelvic floor should kind of sit right even with these bones here. So if someone is a little higher, so even this model is actually kind of higher there, so that is a shortened pelvic floor, and that's going to be something we need to work on, lengthening, relaxing. We call it down training. So today I'm going to teach you the reverse Kegel. This is really good for anyone who does have frequency. You just went to the bathroom and 20 minutes later you feel like you got to pee again and you go in a small volumes, or that diagnosis of overactive bladder. This can be very helpful for that, just to kind of calm down the system. So we call it a reverse Kegel, releasing the pelvic floor muscles, and here is our model here. So you've got to think about lengthening from side to side and from front to back. So the reverse Kegel is more of a blooming flower. So you have the bud and everything is kind of shortened and tight, and you think about letting go and relaxing and opening the area. You're not bearing down, so to speak. It's more just a release, maybe a small, like you're trying to pass gas and nobody hear it, type of bearing down. This is an amazing illustration here of the reverse Kegel with a diaphragmatic breath. So diaphragmatic breathing, usually we recommend for anybody who has that overactivity, that go, that always on. If it's here, if it's in your personality, it's often in the pelvic floor as well. So it is great for that type of person to take 3 times a day, 1 to 5 minutes, to just lay down in a comfortable position and let it go. You breathe in, but the chest does not rise. You take a deep breath and the belly rises like a balloon, and the pelvic floor actually automatically releases, which you can also think about that blooming like a flower. And then you exhale the breath, pelvic floor rises a little bit, and then you breathe the air all the way down to the belly, pull down to the belly, pelvic floor releases, and back. And you kind of find this flow with it, and it can be very cleansing, is what some patients have told me. Just relaxing, just kind of a reset button if things are getting intense for the day. If you feel like your bladder is controlling you and you're not controlling your bladder, if you're just constantly going, this is a really good just like go, reset, relax, and see how things feel. I will have more tips on overactive bladder in the next videos, but for now, the diaphragmatic breath and the reverse Kegel is the main techniques to start working on. Thanks, bye.